Hello and welcome to the Multiple Sclerosis Association of America's live webinar, The Importance of Wellness Care in MS. I am Peter Demiri, Vice President of Programs and Services for MSAA and your host for tonight's program. I'm honored to welcome our guest presenters, Dr. Amy Sullivan and Dr. Mary Rensel of the Cleveland Clinic's Mellen Center for MS. Dr. Sullivan is a psychologist and Director of Behavioral Medicine Research and Training at the Mellen Center. Her work focuses on mental health in people with chronic diseases and their family members, and she is an expert in psychological factors impacting multiple sclerosis. Dr. Rensel is an MS neurologist and Director of Wellness at the Mellen Center. Her work focuses on adult and pediatric multiple sclerosis, brain health, and integrative medicine. Dr. Sullivan and Dr. Rensel, thank you so much for being here tonight and presenting on this very important topic for us.
Well, thank you so much for having us, Peter. We are both thrilled to be here and present with you tonight.
Yes, thank you very much. We're looking forward to it.
Great. Thank you both. So our program tonight is part of MSAA's 2020 MS Awareness Month campaign, The Mind, Body, and MS Connection, which has been made possible by the generous support of Biogen, Bristol Myers Squibb, and Genentech. In addition to this webinar tonight, other MS Awareness Month programs include an Ask the Expert program on March 16th, another webinar on March 24th, and several podcast recordings, which Dr. Rensel and Dr. Sullivan also did for us as well, which all spotlight the topic of wellness in MS. Details on all activities can be found on our special MS Awareness Month website section on mymsaa.org. So as many of you may know, MSAA is a national nonprofit organization dedicated to improving lives today for the MS community. And in fact, this year marks our 50th anniversary as an MS advocacy organization. Listed here are just some of the many free programs and services available to people living with MS all across the country. As mentioned, our website is mymsaa.org, and I encourage everyone to visit our site to learn more or give us a call at 1-800-532-7667. And lastly, this program will be archived on our website within a week of tonight's broadcast. While watching the webinar, we encourage viewers to type their questions into the chat box that's on the screen. We'll have a Q&A session at the end of the presentation and certainly try to get in as many questions as we can. Also, if you're experiencing any technical issues with the webinar, please type your concerns into that chat box, and a representative from ReadyTalk will be there to respond to you. So with that all covered, I am once again honored to have Dr. Sullivan and Dr. Rensel here to present on wellness in MS, and I believe Dr. Rensel will start us off.
Okay, thank you, Peter. I appreciate it. All right, hi everybody. Welcome. Thanks for taking your time to be here. Tonight we're going to talk about wellness and actually define what that is in relation to folks living with MS. We'll learn if we can actually think about managing common symptoms of MS in relation to what we consider wellness practices. And Dr. Sullivan's going to dive deep into the mind-body connection and how the mind can influence the body and the body can influence the mind. And we can harness some of those powers for our health day to day. We're going to talk about brain health and brain reserve and how we can keep our beautiful brains healthy and what we can do to decrease other diseases from affecting our brain. And then we're also going to look at those other diseases which we call comorbidities. So that would mean having MS and another disease, and think about steps to either prevent those or how to manage those. Okay. So we're going to try to keep this simple. This is, I feel like we have a lot of complexities in our lives. It's nice to keep this thing simple as possible. So the really great thing is there's a definition that goes back to 1948 from the World Health Organization. And so many things change, fads come and go in relation to health, and this definition goes back to 1948, and I really appreciate this definition. So the definition of health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So we don't tend to use infirmity anymore. That's kind of a 1940s word. But I love that it says, you can still have a disease or a disorder, but you can still have health. And well-being is a part of all of those parts that we're going to talk about tonight, especially physical, mental, and we're going to talk about social as well. So, how do we define wellness then? So we define wellness as an active process. So it's not something that happens in 1 minute and you're pretty much set for the rest of your life. It's a process where first we become aware of and then we make choices toward healthy and fulfilling lives. So tonight here we are making some awareness and then hopefully some choices. It's nice to have a notepad on these kind of talks so that you can think about maybe 3 things you can do in the next week and make some hard goals. And it's good to start with small little things, set the bar low and make small practices, small changes in your practices for big outcomes. Okay, why does it matter if we do these wellness practices? Well, wellness practices can influence our brain health and what we call reserve. So that's how healthy our nerves are, how much it can take. It's almost like a savings account of the nerves in our brain, and how do we keep them healthy and working as best possible. So the wellness practices influence brain health, and therefore that can lead to physical abilities being maintained, improve our emotional health, and improve the lifespan, how long folks can even live if they're also living with MS. There was a really landmark study done in 2015 by Dr. Marie. She trained at the Mellen Center, so some of you may know her. But her study is called The Effect of Comorbidity on Mortality in MS. So this study was one of the first to show us, my gosh, if you have MS plus one other disease or disorder, that can have some major consequences. So it's really important to think about preventing those, and if you have them, treating them well. So what can well-being affect? Like we talked about, it can affect your physical health, your emotional health, and therefore your quality of life, meaning just how do you feel day to day. And when you feel better and you have better physical and emotional health, generally that also affects your financial well-being and your ability to earn wages, which of course, if that's stable, that also can lead to less stress. We looked at our Mellen Center patients at the Cleveland Clinic, and we asked them, well, what do you do for wellness, and what do you even consider wellness? We saw that as folks aged, they tried more and more wellness practices, and most people would tap into using nutrition to feel better, stress management techniques, and exercise. Those were the most common ones. It wasn't always by age, though. Some people surprised us, and some would start them at a younger age. But they did not link to how disabled a person said they were or how long they had MS. We did notice that male patients, guys, this is for you, so male patients would tend to try less things. They generally would just use exercise as the wellness tool rather than the females that were surveyed, they would try different things like nutrition or stress management and different things. So, people try different things, and that's what we're just going to review, what's out there and what really matters. So here's some major questions. Can we even use wellness tools to help MS symptoms? And can we use wellness to even lessen disability from MS? Is that even possible? Let's talk that through a little bit. What matters with MS in our environment? So in our air and our water and what we take and what we ingest and who's around us and the things that we know for sure where the literature is pretty solid, meaning not many questions in the outcome or the results of the scientific literature. Vitamin D, blood level matters. It may even influence the risk of MS. So if it's low, it may increase the risk of MS. And if it's low once a person has MS, it also may matter for how active their disease is. We're not sure exactly the best level, but it's good to get that into the normal range. So that's a blood test that can be checked once a year. So that can be done by the primary doc or your neurology team. And we also know that smoking nicotine, smoking other things, and vaping nicotine, and just vaping in general can be harmful to the brain. And we recommend folks please stop these practices because it decreases blood flow to the brain. And I think of our brain like a lovely little garden trying to grow, and it needs a lovely little spray of garden hose just at the right force, not too much, not too little, and nicotine really like squeezes the garden hoses closed so the blood cannot get to the brain. So it harms our blood vessels. That's why we know it increases the risk of heart attacks and strokes. And so smokers with MS had more trouble walking earlier. They had more progressive MS. And just last year, one of our fellow doctors at Mellen Center looked at the size of the brain of smokers with MS, and the brains were actually smaller because they were scarring more when folks smoked and they had MS. So it's really important to do everything you can to cut down and stop smoking. And we have some support for that for our Cleveland Clinic patients. But every primary care doc can help you with that, and the neurologist. Just ask for help because it's a hard thing to kick, nicotine addiction, but it's super important. And what about obesity? So we hear about what we call sometimes lifestyle diseases. So sometimes it is someone's lifestyle and sometimes it's someone's genes that leads to a higher risk of obesity. Well, there was just a study done and a big meeting a couple weekends ago, and people were presenting their research about this, and it looks like when the lipid level or the fat level in the bloodstream is high, we can see more new lesions of MS on the brain MRIs. We also see when folks take a diabetes medicine, they have less activity on their MRI. So it could be that high blood sugars also is a bit inflammatory or increases the risk of more MS lesions on the brain. We did not see any change in the gray matter volume of the brain. In our brain, we have gray and white matter, different parts of the brain. And in patients that had MS and were obese, we did not see a change in the volume or scarring of that area of the brain. We did see more relapses, more new symptoms of MS when folks had MS plus those other diseases, which is that term comorbidities. We also saw more nerve fiber loss or scarring in the back of the eye, and you could test that with that test called OCT. OCT is an ultrasound that can test the thickness of the nerves in the back of the eye. So it's a very quick, easy, cheap test, and it did show that obese patients had more nerve scarring in that area. So probably best to try to get to a healthy weight, and again, if you need help with that, that would be something a primary doctor could help you with, and we have wellness programming at the Mellen Center to also help folks learn about that. So speaking of obesity, then we might as well talk about, what should we eat day to day. So how do we even know if a diet is important with MS? Honestly, at this point in time, we do not know the one diet for all MS patients. There's been many different diet studies in MS, and like the last line says on this page, there was a low-fat diet and a plant-based diet, and that particular diet study did not show any change in relapses in the MS folks that were watching their diet either for fats or were only eating plant-based diets. But we know, lifestyle factors are intertwined, right? We're not only just what we eat that day, we also, sleep and move, and so maybe a lot of these factors come together and help us with our health journey. There's a lot of studies right now going on with MS and diet, so we're going to know more in the next year or two or three. There was one study looking at what's called the modified Atkins diet, but it's a very small study. And it did show help in decreasing BMI, which is body mass index, so that's the height according to weight. So there's a healthy range of weight for your height, and that increased or improved the weight of the patients. And here's some great news. It also improved fatigue and depression. So diet may indeed help some very common MS symptoms, like when we go back to the one slide when we started this, saying, well, could these lifestyle behaviors actually help MS symptoms and or, the level of disability over time? And the answer is, maybe it might be possible. Now, when we talk about a healthy diet in MS, there was a NARCOM study that was reported in 2017, and it said in the patients that ate more fruits and veggies and more whole grains during their days rather than red meat, so if they ate less red meat, less processed meat, and less added sugars, especially sugary drinks, they actually felt better. They reported less disability during their days, and again, less depression. So here again, we have an example of where a healthy diet has actually improved moods, which is great. And it also may indeed improve neurologic functioning. So there were some studies looking at how fast the hands moved, or how fast the walking was, and a healthy diet seemed to improve that. And at another level, it also seemed in a study just reported last year showed with a healthy diet, they saw less new lesions on the brain MRI, and folks who ate that healthy diet. Now notice here that this plan is not very detailed. It's not saying you have to do something every single day. It's more of a ratio, so more of the good stuff, less of the more negative things. So more of the fruits, veggies, whole grains. And this had major really beneficial consequences. So on both functioning day-to-day, depression rates, and also MRIs. So we've gotten a lot of questions lately about caloric restriction or eating lower calories, either certain times of the day or throughout the day or certain days of the week. So there's a few studies looking at this. And some of the studies are animal studies because there's an animal model of MS, and then they can get more information from the animals testing. But it looked like what we call the gut microbiota. So that is, this is a really great concept that we have all these bacteria and virus that live in our GI tract, and they break down our food for us. So depending on what food we eat, we may have different organisms there. So when folks ate less calories, they had more different kinds of what they will call tactile or different kinds of organisms living in the gut. And then it turns out that those organisms in the gut can actually influence the immune system because our immune system wraps around our colon and our intestines. So very interestingly, our food can actually change our immune system through that what we call microbiota. We did see in these particular studies that it was pretty hard to stick to really tough diets. I mean, people are human after all, right? And so it's hard to be perfect. We really don't know any perfect human. So we have to acknowledge that it's really hard to do this. But like in the slide we just saw, we noticed that it's more of a ratio. If you do more healthy things than non-healthy things, it really helps. Now what about just moving and activity and exercise in folks with MS? There's multiple studies showing that exercise itself can help improve or maintain functional abilities, so getting around and moving and strength. It can improve aerobic fitness, our strength, our fatigue, quality of life, depression again, cognitive function, so memory, so that's good news. And then again, those chronic disease risks. So it decreases the risk of blood pressure, obesity, diabetes, so a lot of very positive health benefits. But despite this, a lot of folks with MS are still not physically active. We're not really sure why that is because it really doesn't correlate with a level of disability or ability. So it might just be that darn fatigue that we hear often, and I'm sure you could tell me about. But you might want to think if you're feeling a lot of these things on the top line there, either depression or feeling memory problems or dealing with some quality of life feeling just, oh, my days are hard or I'm really fatigued, exercise might be something that may be able to improve that for you. So this slide is about a study that was done in Canada where folks with MS were asked to exercise twice a week for 30 minutes, a moderate level of cardio exercise, and then also 2 other days of some strength training. So 4 days a week. 2 of the days were cardio, 2 of the days were strength training. What they saw is they saw an improvement in strength, so muscle mass. They saw improvement in walking. They saw 40% less fatigue, and they saw an improvement in quality of life. So really beneficial, again, really beneficial effects. And, the time put into this wasn't too bad. 2 times a week of 30 minutes, and then again, 2 days a week of some strength training. Now what about kids? Kids get MS, and teens can get MS. It's very rare, thank goodness, but it can happen. And one thing that's been clear in general health studies is that we can see that atherosclerosis, or the hardening of arteries, or inflammation in the blood vessels that can lead to strokes and heart attacks, can even begin in childhood. And it can continue to worsen childhood and teen into their adult years. So lifestyle choices as a child, as a teen, as a young adult, it all really matters for our brain health, and it matters for our cardiovascular fitness, so how fit our heart is, and our blood vessels, like we talked about, those garden hoses that have to sprinkle our lovely brain just right. If they're too hard or too stiff or too inflamed, they can't regulate how much blood flow there is to the brain or the heart, and so that can be a problem. So lifestyle matters for kids and teens as well. And dietary patterns and lifestyle activity and how active kids or teens are, a strong pattern is set in their teen years and in their years as a child. And they really definitely model their parents. So that's something to think about. If you have kids in the house and you had a long day at work and you really don't feel like doing anything, maybe just 10 minutes, let's say let's do a stretch, or let's go for a walk down the street and back, just something to show them that this is a priority. We know that when kids grow up in a home with smoke, or if they smoke themselves as teens, they have an increased risk of getting multiple sclerosis. We know poor diet is a risk to even get MS, and inactivity, as we just talked about, is very common in MS. So we really want to just set some great examples for the kids at that age. Now, let's talk about brain health. So we hear a lot about heart health. So we're all pretty familiar about what matters for heart health. So we know no smoking and see your doctor, watch your cholesterol. But when we talk about brain health, we also have to talk about our emotional health, which Dr. Sullivan is going to go over in detail. But that is incredibly vital for our brain health. So here's a list of things that really matter to keep our brain well. And when MS is already there, in the brain, we want to build that brain reserve we were talking about. We want to make sure all the nerves that are there are just supported and working well and getting what they need. So exercise, again, really matters. The one Canadian study, they looked at exercise twice a week, but really the American Heart Association recommends 150 minutes a week of some kind of moderate level of movement. So that could be 30 minutes 5 times a week. That seems to keep the brain and the heart in the best shape. So if you're able to, or that may be one of your goals, and take a note on your piece of paper there, is just write down. If you're not exercising at all, you might want to say, I'm going to do 5 minutes twice a week this week, and that's going to be my goal for a couple weeks. And then reward yourself when you hit it with a nice I don't know, flower, something, a nice walk with a friend, And then healthy diet we discussed. We talked about risk factors such as smoking, and excessive alcohol is also another brain toxin. So there are recommendations on the CDC website about alcohol intake for males and females, but excessive drinking is a negative, or it's a toxin for brain health. Social engagement really matters. So this is really great news. So in order to keep your brain healthy, you just have to go out and have fun and call a friend and go for a walk, or go have coffee, or just call a friend and connect. So being more engaged in your community and with friends and with your neighbors actually helps your brain, because it makes it interact more, and to read the person that's talking to or interacting with, and it takes brain power. So that's good for the brain. Preventative care means going to your primary care doctor and making sure that you're looking over family history and looking over blood pressure and cholesterol when you need to, depending on your age and family history. Stress management we're going to hear about, and then sleep and relaxation we're also going to hear about, but there's some really interesting studies about the importance of sleep, that when we sleep, our brain is actually kind of washing away some of the negative proteins that we see with even things like Alzheimer's, and it's a time when the brain rejuvenates and repairs from the day behind it, and then prepares for the day ahead. If we sleep well, we have better alertness, better performance, better what we would call executive function, so our memory and our decision making. So sleep is really a way to, keep your brain healthy and keep your brain actually working really well. So this slide is, again, to remind us the importance of prevention. So we know when somebody has high blood pressure or high cholesterol that taking a medicine to treat that can decrease the risk of a heart attack or stroke. But what we know is even avoiding even getting those is even better. So whatever you can do to go see the primary doc and learn about how to manage cholesterol, how to eat a diet that's healthy, how to exercise like we just discussed, how to sleep well, how to manage stress, all of those will help you prevent those other diseases. Now, as we talked about, the heart is a pump, and it pumps the blood up to the brain. And so we need to think about it, even though, of course, as neurologists, we love the brain so much. So our brain is our top priority. But the heart matters as well. So how do we keep the heart healthy? Well, the same things help both, but we don't want any smoking or nicotine. The heavy drinking is really negative for the heart as well. The heart-healthy diet is like what we discussed, a lot of good, colorful, fresh fruits and veggies and whole grains and less red meats, less processed meat, and no sugary drinks. And then cognitive health can be maintained by keeping your heart healthy because it'll pump that blood right up there where you need it. And then again, it can decrease the risk of disability, which is such great news. So the American Heart Association says some ideal behaviors are these. So maybe you get out your paper and you say, okay, what do I do on this list? If I'm smoking, I'm going to cut back. I'm going to go see my primary doctor and see what my options are. Or I'm going to call 1-800-QUIT-NOW. That's a phone 1-800 line that you can call to get support. It's free to help you, figure out ways that you can cut down and then with the goal of quitting smoking. We want to keep our body mass index, which is our weight according to our height, less than 25. 18 to 25 is the normal range. If you're not in that range, you might want to talk to your primary doc about options. How do I get there? It might be movement. And it actually, another good news is sleeping can help manage weight. So if you're working really hard and you're sleeping just a little bit, sometimes that can actually lead to weight gain. So if you're not sure how to lose the weight, the exercise like we talked about, healthy diet, and really healthy sleep can be a good start. Physical activity like we discussed, that's 150 minutes a week as you're able. The healthy diet we discussed. And then when you go to your doctor, you want to ask them, what is my cholesterol level? What is my blood pressure? And what is my fasting blood glucose, so I know for my heart and my brain health. So those are things it's nice to ask your primary doc so you can get an idea of where things are. Okay, so now it's all on Dr. Sullivan. Thanks for listening.
Well, thank you again, Peter, for having both myself and Dr. Rensel today, and thank you to Dr. Rensel for such an informative presentation. I'm so fortunate to be able to work right next door to her and have interaction with her on a very regular basis, and she teaches me something new every day, and this was no exception. So when Peter first asked us to contribute to this, we both thought that it would be best for us to present together because we like to present a united front in terms of wellness. So how do the mind and the body interact? And so I'm going to spend my time today speaking about stress management and how that is helpful in terms of managing not only our mood, but our MS. So first I'm going to start with a basic review of the nervous system. So what you're seeing here is the sympathetic nervous system, which is otherwise known as the fight or flight, and the parasympathetic nervous system, which is otherwise known as kind of rest, relax, rejuvenate. And the interesting thing about the fight or flight and the rest, relax, rejuvenate is that they cannot both be turned on together. So when I look at the sympathetic nervous system, the fight or flight, so you'll remember this from your early days of biology, and the sympathetic nervous system was created for human beings to respond to fear, to when hunters and gatherers were, in the world, they were being chased by a tiger, and they had to turn on all of these fear responses so that one could get away from a tiger. Well, unfortunately, now here we are at 2020, and if we look at the majority of our sympathetic nervous systems are turned on all the time, and so you can see that it does all of this really negative stuff to the body. And so my goal with my patients is to help people turn on the rest and relax or the parasympathetic nervous system. So let's talk a little bit more about the effects of stress on the body. So I really like this slide because it shows us all of the things that stress does negatively to our body. So it impacts our brains, it impacts our mood, our cardiovascular system, it impacts our immune system, our GI system, our sexual functions, and then our joints and bones. So what I'd like to do is present some data with regards to the importance of managing stress in the multiple sclerosis population. So we had initial studies. So back when Charcot first was talking about MS, so he's kind of one of the first people who ever talked about MS or diagnosed a case of MS. He saw that stress was a contributing factor to his primary cases. We've also seen self-reports in class 3 studies, such as wars, where individuals that were either impacted by war or were actually fighting in the war, were after the war were presenting with more MS. And so we've recently seen one class 1 study, which was by David Moore and his colleagues, and this was in 2012. And David Moore is out of Northwestern. And so this was his study. It was called a randomized trial of stress management for the prevention of new brain lesions. And what his study found were that individuals that had participated in his stress management protocol, so he had a 16-session stress management protocol, and individuals had participated in his stress management protocol as compared to people who were in the control group, had found that they had fewer GAD-enhancing lesions and fewer T2 lesions at the end of the study. And what was interesting about the study was that not only that we were able to see the evidence on the MRI, but also once the individual had stopped participating in the stress management, the results were not there anymore. So people were no longer receiving benefit. So what this tells us is that it's important to have active participation in stress management on a daily basis and a very regular basis. And so I'm going to teach you some of the things that we do in our practice at Mellen Center. So if you're willing, what I would like for you to do is for the next minute, I want you to count your breath. All I want you to do is get in a relaxed position and sit back, and when I tell you to start, just count your breath. Ready? Start. Okay, stop. And so keep that number in your head. Okay. So the good news and the bad news is that in my field, if you're breathing more than 12 breaths per minute, you are hyperventilating. And so this is very important for us because if you look at the PET scan that's shown in the photo, hyperventilation reduces the oxygen delivery to all vital organs of the human body, and particularly here with the brain. So the left-hand picture is an oxygenated brain, someone who's not hyperventilating, and the right-hand picture is a deoxygenated brain, so someone who is hyperventilating. And so why this is important for our practice and for our MS population is that sometimes there are people are concerned about their memory, and it can be linked to stress. can be linked to hyperventilation, and this is something that we can really help with by way of teaching some of these stress management techniques. So one of the skills that I like to teach my patients is diaphragmatic breathing. So the diaphragm is the large muscle that's located between the chest and the abdomen. So it's like that upside down U. And there are a lot of lymph nodes located just below the diaphragm. So it's important for us to oxygenate our body so that so our lymph nodes can do their job. So by oxygenating our body, that means stopping the breath. But that means not stopping the breath at the chest, and instead pulling the oxygen all the way into our lungs and into our diaphragm, expanding that diaphragm so that we can enhance all of our vital organs with oxygen. And so I'm going to teach you a skill by way of using diaphragmatic breathing. So what I would like for you to do is to put one hand on your chest and one hand on your diaphragm, and just take a second and find that. This is a very difficult skill to learn, so I just want to let you know that in my practice, it takes us about 45 minutes to teach this skill. But what we do know is that people that have a yoga background, so who are deep breathers, people that have who are singers, who have played wind instruments, who are runners, swimmers, tend to do very, very well with this. So try to put one hand on your chest and one hand on your diaphragm. And all I want you to do is just observe where your breath is coming from. Is it stopping in your chest, or are you pulling it deeply into the diaphragm? And just observe at this point. And so what I'd like you to do tonight at some point is to lie down trying this. Because you can really expand the diaphragm and feel it a lot better if you're not sitting down, or to recline in a chair, and that can really help you as well. Okay, so keeping in mind the diaphragmatic breath, we're going to move on to another exercise that I like to teach. And this is called circular breathing or serial 3 breathing. And so what this is we start with the inhale at the bottom, and what we do is we take a slow inhale for 3 seconds, and then we hold our breath for 3 seconds, and we exhale for 3 seconds. So we have a 9-second breath. And so our goal really is to have less than 6 breaths per minute. And by doing this circular 3 breathing or serial 3 breathing, we're able to get ourselves to that. So your inhale will be 3 seconds, your hold will be 3 seconds, and your exhale will be 3 seconds. And again, you should have equivalent to about a 9-second breath. When people get really good at this, they actually add a little hold after the exhale, and it becomes a square breathing. So we're going to practice this one as well. And this time, I'm going to time you again, and I want you to listen to me for the first cycle. And then I'm going to let you take over on your own in your own heads for the cycles afterwards, because your cadence is likely different than mine. So listen to what I say. When you're ready, we're going to inhale, 2, 3, hold, 2, 3, out, 2, 3, and take over. Okay, stop. So your goal should have been 6 total breaths per minute. And what I also incorporated in this exercise was some mindfulness. So mindfulness just means staying in the present moment And so when we're able to focus on something such as the circular 3 or serial 3 breathing, and we focus solely on that without thinking about anything else that's going on in the world, that's a mindful moment. So that's another skill of stress management that we teach. So what you were able to do successfully was to move yourself from fight or flight into the rest and relax. And if you were in my office, I would have been able to hook you up to a biofeedback tool. And the biofeedback tool would be able to read your physiological response to stress. And so what's really neat for me is to be able to show our patients this data over the course of time. So we're able to show patients how their breathing has decreased. We're able to show our patients how their saturated oxygen increases. We're able to show our patients how their heart rate decreases over time. And we're also able to show differences in mood, such as anxiety and depression, once they participate in some of these techniques with us. So how do we encourage wellness in the Mellen Center? So what we do is we encourage education. So Dr. Rensel had given you a lot of information about about how she promotes education, and we promote wellness behaviors. We also model those behaviors. So many times our patients will say to me, especially because I have 45 minutes to an hour with a patient, and they'll ask questions. Well, how do you do this? Or what do you think about this? And so we model that behavior. We encourage small steps. So with regards to setting goals, I think it's very appropriate to set long-term goals, but they're going to be small steps along the way, and that's progress. So if somebody has a goal of losing 20 pounds, we don't focus on the 20 pounds. We focus on the 5 pounds that an individual lost over the course of 6 weeks or 8 weeks. And so we really celebrate that. And we also don't waste any moment. So if somebody says, I really fell off the bandwagon today with regards to my wellness or my exercise, then we say, well, let's pick it up tomorrow or even tonight. There's no time like the present for us to help people change. So when we think about why wellness is so important, it is, as Dr. Rensel had said, it has so many implications for the body, but I also look at the role of positive thinking in people. So we work from a model called behavioral therapy, or CBT. And so I help people really to evaluate their thoughts. So are there distortions in thoughts? Are people's thoughts pretty accurate? And so we look at their thoughts about why wellness is important and have them list those out for us. We make sure that they're looking at the entire mind and the body. So what are the physical effects of it? What are the psychological effects of it? What are the social effects of wellness? And then we empower them. So self-efficacy is a term that I really love because it empowers the patient to do things to help themselves. And so we remind people that you have a lot of choice in how you choose to be well. We also help them to recall the past. So what worked when they were using exercise to feel better, or what worked with a diet that was very successful, and how did they feel? And typically over the course of time, people will say, gosh, I felt so good when I was on that diet. I don't know why I ever stopped, eating in that healthy manner. Or I felt so good when I was exercising on a regular basis. I just want to get back to that feeling. And then we reinforce through positive thinking. And so I also like to talk about resiliency in the face of adversity. And so what that means to me is that you, myself, Dr. Rensel, Peter, all of us have built-in resiliency. And this is something that develops over time from adverse situations. But what resiliency means is that despite the fact that we've had some adverse situations, we're overcomers. We can still lead very successful, very productive lives. And we do this by developing resiliency. So the way that we develop resiliency is by this. So it's a 3-step model. First is understanding. So it's investing time and energy to learn as much as possible about our situation. So while I'm not advocating being Google Doctor, what I am advocating is doing things like this, a webinar with experts in the area, or talking to your doctor about the realities of your situation. So the next step is managing. So this is learning new coping strategies and lifestyle behaviors and discovering how you can be the best that you can. So again, this is the self-efficacy. This is the empowerment. And what I like to say in my practice is that I don't really believe in accepting a disease. To me, that feels very passive and it feels very powerless. And instead, what I believe in is adapting to your disease. So how can you still have the life that you want by adapting to your disease? So figuring out a new path for maybe some functional impairment or some cognitive dysfunction, and we can help you do that. And then the third is growth. So this is experiencing shifts in priorities. This is developing better understanding of what is important to you. This is very value-oriented and making sure that you still have passions and develop steps to strengthen relationships. So this is a very, very value-oriented, progressive way of thinking, and this is resilience. So this is making sure that you're investing your time and your energy into things that are incredibly important to you and taking less time to devote to things that are not as important to you. So this is a handout that I give my patients very frequently, and this is on the 13 skills to help develop resiliency. And you guys are welcome to take this and put it on your fridge or on your bathroom mirror. And so some of the things that I think are really important are maintaining these strong social connections. Relationships are just incredibly important in terms of filling us with positivity. So making sure that they're really good, value-oriented relationships. Maximizing your physical wellness and setting realistic goals, as we had talked about earlier. Practicing gratitude. So there's a whole new literature on this right now, and this is something that we do on a regular basis in my practice. And this is to, sometimes my patients choose to journal, so they choose to write down something on a very regular basis. So it could be nightly, it could be 2 times a day, 3 times a day, about what they're grateful for. This can also be sending somebody a card that has been, very influential in your life. However you want to practice gratitude, there is some literature out there that shows us that gratitude actually changes the brain. And it's also really fun for the person who is receiving the gratitude if you choose to send a card or do something little for somebody, because they're going to also have a change in their brain. So number 5 is nurturing positive emotions. So that means, making sure that we, if there's something that makes us feel really joyful, making sure that we do that very regularly. And number 6 is also allowing ourselves to feel negative emotions, because in order to experience joy, there is sorrow, and we have to be able to experience the full spectrum of our emotions. And so making sure that we are able to experience those negative emotions, but if this becomes something that you're ruminating on a regular basis, then it's important to get help. Next is practicing forgiveness. So while I'm not advocating for forgiving somebody who's done something terrible and awful to you, what I am advocating for is forgiving yourself, forgiving people that are important to you, and not holding on and harboring those negative feelings. So 8 is utilizing mindfulness. So we talked a little bit about mindfulness earlier, but mindfulness is really staying in the present moment, so not looking ahead into the future, where you can have anxiety or fear, and not looking behind in the past where you can have regret or remorse or depression. And learning how to stay in the present moment, and then practicing these relaxation approaches. I've given you a couple of them tonight. Number 9 is planning for the future. So if there is uncertainty in your future, making sure you take care of that and planning for that. You'll feel a lot better after you get those plans out there. 10 is helping others, and that speaks for itself. 11 is finding meaning and purpose. So making sure, again, that we're practicing we're finding meaning and purpose from a value-oriented place. 12 is if you believe in a faith, practicing that, or spirituality. So that can just be, having a relationship with the outside world or nature. And then 13 is learning to retell your story. So again, this is adapting versus accepting. So this is learning how to retell your story in a positive way. So if you have experienced some difficulties, learning how to then say, but this is how I've adapted and developed resilience. So as we end and get ready for questions, I'm just going to give a couple of take-home messages. So wellness practices have a major impact on how patients live with MS. And our practices can help symptoms of MS like fatigue. It's important to develop an understanding of the mind-body connection and how the mind influences the body. Brain health includes preventing or managing vascular risk factors and emotional health practices. And comorbidities, MS plus other chronic diseases, can impact long-term health in patients with MS. So the last few slides are just resources, but again, this is going to be archived, and so you're welcome to look at these as we go. So I'm just going to get to again, just resources. I'm just going to get to questions for myself and Dr. Rensel.
Well, thank you, Dr. Sullivan, and thank you, Dr. Rensel, as well. What an excellent presentation. Tremendous amount of great resources, insights, and I especially love the breathing exercises as well.
Great.
As you mentioned, sure. As you mentioned, we have quite a number of questions that came in. A few do center around diet and diet and nutrition. One question is, what is the modified Atkins diet? I am very familiar with the Atkins diet, but not sure about the modified diet.
Yeah, so there's, of course, always variations on a variety of studies. And this one, the ketogenic or the Atkins diet was very tough to follow. I just want to remind the audience that this was a really small study with what's called the modified Atkins diet. And it still has high fat, but it has low carbohydrate, but more carbohydrates than the ketogenic diet. So it's less restrictive. But as I said on that one diet side is that we do not know that you have to go through something like this, and because the ketogenic diet is hard, and there's been some new studies showing that probably the high fat is not good for vascular health. So I would kind of hang in there and follow the general recommendations for a healthy diet. There's some resources that come in some of the slides after this one with questions that you'll be able to get to in the archives. So it means a little bit more carbohydrates, and that you can actually eat out of your house if you're on that diet, rather than the true Atkins diet. Very
good, thanks. Another question on diet is, should we be gluten-free?
The good and bad news is we do not know the one diet for MS, and so there is no reason you have to avoid gluten because you're living with MS. Some people will report eat less white flour, they feel better, they have better energy. White flour turns into sugar pretty quickly as we metabolize it, and it tends to make people tired. So I'm a fan of kind of reading labels and making sure that the product doesn't have a lot of added sugar or a lot of white flour in the first few ingredients, because that does make anyone more tired and it gives people higher blood sugars. But it may also contribute to just more fatigue that folks living with MS already experience.
Excellent. And in terms of exercise, I know obviously each person is different and their MS affects them differently, but some people want to know any specific exercise suggestions, criteria, and certainly taking into account heat intolerance and maybe some balance and mobility issues.
Okay, I'll do this one, I guess. I would say we do not know the most important thing, but recently at this recent meeting, there was a study on social connections, and that if a person is very isolated and is not connected to other people, they have the risk, the mortality risk, the risk of dying as somebody who smokes 3/4 pack of cigarettes for multiple years. So it has a great effect on general health when we are lonely. So we do not know the most important one. But I do want to say, as a lot of your comments are mentioning, like here we are in this time of coronavirus, And so it is a time, unfortunately, to restrict social activity and good hand washing and avoid unnecessary trips, et cetera, because of the risk of viruses. But in a normal time, without an infectious, the flu season or this coronavirus, it is good to have a social network. It's healthy.
Very good. Thanks.
And I would just add to that, though, so that we don't, I think I don't want to stop all social activity. So I think if you're in small groups of people who you know are healthy, I think that we can still maintain some social connectedness.
Very good. Absolutely. In terms of breathing, Dr. Sullivan, you took us through the wonderful breathing exercises, and you mentioned about 12 breaths per minute. But I guess the question is that around just sitting and resting, or what about daily activities and maybe even exercising?
Yeah. So we want you to have less than 12 breaths per minute. My goal actually is for you to have 6 breaths per minute. So when we do 6 breaths per minute, we know that we're moving from fight or flight into rest and relax, which is where I really want our bodies to kind of sit. And that may mean practicing these breathing techniques. Of course, when you're exercising, you'll have more breaths per minute. And that I'm not counting that. I'm just counting what your normal breath would be, and then in addition, what your breath would be as you're relaxing.
Very good. Thank you. Here's a question that talks about just all aspects of wellness. So while all aspects of wellness are important, is there one piece that should be focused on first before others to help the other parts of wellness kind of fall into place? For example, focusing on positive thinking and emotional wellness to help physical activity.
Yeah, I love that comment. Yeah. Is it okay if I take that? Okay. Yeah, I love that comment. I think the more positive self-talk we can do with ourselves, I mean, if we think about what the mind does, the mind is so powerful. It helps us in motivation. It helps us on staying on track in terms of concentration. It helps us from reducing stress and reducing depression and anxiety. So I feel like if we can get our minds healthy, then that kind of influences everything else. But I also think it's the same with physical wellness. So maybe if you focus on one aspect of your physical wellness, now let Dr. Rensel answer what her recommendation would be for that.
Yeah, I agree that the emotional health, it all comes from the brain, right? So, and things that support brain health, we just went over that list. They are all the good, behaviors we can do throughout the day, like good sleep and good emotional processing and good nutrition and drinking water and not smoking, not hurting it, not doing anything to hurt the brain. So I can't really choose one. I mean, I think it's a journey, and like we heard about. The definition of health, it's more well-being. So how are you being? What are you being during the day? Like how well are you during the day? What are your choices throughout the day? And that can improve your health. And we really can't split out our emotional and physical health because it all comes from the brain, and we need to serve that organ because it makes us who we are. So, I don't know. I can't choose one because I think probably on different days you focus on different things, and there's days where you have time to exercise or stretch. You have days you can journal. You have days, you might have less sleep than normal. So there's no one thing. It's more of the journey, like we heard about. The wellness is more in action.
Right, and hence that mind-body connection where it really is all integrated, correct?
Mm-hmm.
Speaking of emotional wellness, the question about how do you find a psychologist that is trained in MS?
Yeah, that's a great question. I also wanted to address this question from Corey, which says, is it commonplace for physicians to help MS patients with the breathing work you described? So I'll address both of those together. I had an opportunity today to meet with our new MS director in Abu Dhabi. And he sat with me, and he wanted to know how to do these breathing techniques that we have talked so much about. And so I walked him through those. And while he said very clearly. He said, I don't have as much time as you do, but if there's some way that I can help somebody in a quick second, what would you do? And so I taught him the diaphragmatic breath, and if you just take it one step further to do the serial 3 breathing, I think that that's something that is very quick in terms of helping. And yes, there are physicians who are very, very interested in this work, and many of them can teach some of these skills of breathing. I know Dr. Rensel can, because she's heard me do them so many times before, but she also practices her own mindfulness. But if your physician doesn't, then what I would like to suggest is that there are ways to find providers who specialize in MS. I know the National MS Society has a navigator program, and they have all the providers who specialize in behavioral medicine and MS listed on their page. There's also, your doctors will also probably have somebody that they refer to, and so I think just connecting with your doctor or your advanced practice provider or some of the nurses about who they send patients to, they'll have great recommendations for you. But really what's important is that this person is a health psychologist or somebody who focuses on chronic disease and wellness and has that background in terms of managing the response to stress and how that impacts your disease.
Very good. Thank you for covering both of those points. We have time for one last question, and I know, Dr. Rensel, you mentioned about the importance of vitamin D. That, along with a question about what other supplements should I take for my MS?
Yeah, I think that's the other good news is we don't need to rely on a lot of supplements for multiple sclerosis because none of the studies have shown that it helps actually the disease or process of MS, like how many lesions there are, or how active they are. So, when you walk into those aisles of the stores or certain supplements stores in the mall or what have you, you don't need any of that beyond a multivitamin and a vitamin D. Once in a while, if somebody has fatigue as part of most of their day, a B complex can help sometimes energy a little bit, or coenzyme Q10 has been shown to help some like painful numbness. But you don't have to take those unless you have those symptoms. Sometimes those symptoms can help. We did actually just get the results of the biotin study in MS, and that did not show that it was very helpful for most MS patients. So that was too bad because a lot of folks have been trying the biotin as a way to help functioning with MS, like walking and endurance and things. And so the big study that was done with biotin was just released today, and it did not show that it helped very well, so unfortunately.
Okay, well, thank you for that. And actually, this does take us to the end of our program tonight. And I once again want to thank Dr. Amy Sullivan and Dr. Mary Rensel for their excellent presentation and really helpful insights on wellness and MS. I know I learned a lot, and definitely try those breathing exercises on my drive home tonight as well.
Don't do them on your drive home. Do them when you're sitting.
Okay. Also, I want to thank our funding partners, Biogen, Bristol Myers Squibb, and Genentech for supporting this webinar, along with additional programs for our MS Awareness Month campaign. As mentioned, tonight's webinar will be archived on our website at mymsaa.org, and they'll probably give us about a week to get that edited and up on the site. And finally, please consider completing a very brief evaluation survey that is coming up next. So on behalf of MSAA, thank you again so much for watching, and have a great night.